country. But as far as the providing power, which is actual generation, is concerned, we lit every fourth bulb in the country. So that speaks a lot about the efficiency of the company. We are in fact the number one as far as efficiency is concerned in the world. We have been recognized as such by brands. And as far as electricity generation is concerned, we are just number one efficient power producer in, I would say, the whole of the world. But that's not all. It's not just electricity, but CSR, the community development, is very core to our heart. And in not just aligning with the Companies Act 2013, we have been doing much beyond what the Companies Act requires us to, while focusing on our CSR projects, which is on healthcare, education, skill development, women and child empowerment, environment and sustainability, and livelihood promotion. So it's, as far as the company is concerned, we have spent over 527 crores in year 25-26 alone, which is much beyond 2% of our net profit, which is mandated by the Companies Act. So we are proud that our CSR initiatives are benefiting over 1 lakh people in more than 500 villages. We are, in fact, NTPC is present on 119 locations in the country. And I was just sharing with sir that our basically objective is that wherever we are there, we connect with the community with health, providing life support, and ambulance is the first thing that we think of. So here, when we are providing these ambulances, which are 19 in number, where it was just shared that these are 2 cardiac ambulances, 8 advanced life support ambulances, 6 basic life support ambulances, along with 3 medicine and written transport vans. So it's not just that we are giving away these ambulances, but we believe that these are the life support of any hospital, any health infrastructure, and that with this, this would be a main asset which would provide hope and timely help to those in need. And I would also share that as far as Western region is concerned, health is our very primary focus, where we have not just provided ambulances, but also have provided strengthening of blood banks through advanced medical equipment, upgradation of NABL laboratories, modern diagnostic devices, enhancement of hospital facilities, and providing essential medical equipments. And not just that, but also awareness on health and hygiene, menstrual hygiene, and cancer awareness. So as far as the company is concerned, we are doing a lot, and even we have provided upgradation of radiotherapy services at GCRI and high energy cleaner resonator technology. So these are a few of the advanced initiatives that we, as part of the region is concerned, we are associated with, and this is a very prestigious project for Goa. And we are so happy, and I thank Honorable Minister of State for Power and you, Renewable Energy, who has given us this opportune moment to be associated with this. So, sir, आपका बहुत बहुत शुक्रिया हमको इस प्रोजेक्ट के साथ जोड़ने के लिए. और Honorable Minister of Health, sir, मैं आपका interaction इस hospital के साथ देख रही थी, and I was amazed that you knew so many people by name. So I can understand कि आप इतना closely connected हैं it's a health community से गोवा से. So definitely I'm very sure कि हम ये जो आज provide कर रहे हैं ambulances, they'll go a long way in being the critical lifeline support for the Goa health services. Thank you so much, and we are so happy to be part of this. From NTPC, I thank you all for us. Thank you.
Thank you, ma'am, for enriching with your profound insights. As we move forward with the knowledge and inspiration gained from your words, we express our sincere appreciation to you once again. Ladies and gentlemen, we are truly honored to have with us today our Honorable Minister for Health, Urban Development, Town and Country Planning, Women and Child Development, Forest and Ayush, Shri Vishwajit Rani ji. Sir's dynamic leadership has been pivotal in advancing the state's healthcare agenda. Under Sir's guidance, the Health Department has continued to strengthen the healthcare infrastructure, expand the emergency medical services, and promote equitable access to quality healthcare for all. The encouragement extended towards collaborative initiatives under corporate social responsibility has enabled valuable partnerships that complement the government's effort in enhancing public health services. Ladies and gentlemen, please join me in extending a warm welcome to our Honorable Minister for Health, Shri Vishwajit Rane sir.
Good morning to every one of you. Let me start by paying condolences. We all in silence with the loss of our former director, Health Services, Vandana Goem. And actually, I was just talking to somebody that I should go and visit her. Somebody mentioned to me. I think I called Kedar. I just said I want to go and see her. But then morning I got the news that she is no longer with us. And it's a very big loss to our department. And like it was just introduced here, and when you lose somebody like that who's totally committed to the healthcare and healthcare services, it's very important for us to initiate these type of initiatives, of life-saving initiatives in memory of such people who have committed, and our ex-director, committed to her whole life to the health services and strengthening of the health sector. Today present among us is my leader and Union Minister for State, Shri Shripad Naik ji, present here is Dean Goa Medical College, Madam Chaturvedi, Regional Director, NTPC, Director Health Services, Joint Secretary Health and Finance, Shri Bhatt, Kedar, Riker, Dr. Yuri, and all the other dignitaries present here, members of our team, and everyone present here today. Actually, it is something very important for us, this initiative, and Goa Medical College is something which is very close to my heart. And these type of initiatives, and with the support today with Mr. Shripad Naik's initiative, is consistently being supporting all our initiatives and also our cardiac ambulances. And I just want to share with you that cardiac ambulances doesn't exist anywhere else in the country. Because we ourselves came out that we want to have these type of ambulances so that we are able to have advanced cardiac care facilities. And member who helped us in starting our program called STEMI after the cardiac ambulances is Dr. Guru Prasad, who is present here with us, who just returned back from America. And this was something which was very important, and no other state. STEMI, actually when you go to the Government of India NHM manual, they say it's a STEMI program is like they say that the online to the Goa model, which is very great moment for all of us. Today, I don't want to say much. I just want to thank Mr. Shripad Naik for having, our Honorable Union Minister, for having always supported the initiative of 108. Life-saving initiative is something very important, and reducing time for response is something which is very important to all of us. And also having advanced, we also in the state of Goa, we have neonatal ambulances, we have several other screening programs, and also these type of ambulances, when we have it and we have someone like him who is also committed to the healthcare of the state, I think it becomes much more easier for us to put our point of view across. And even without telling him, he is always at it, trying to see what best we can do to strengthen the health services in the state of Goa, trying to see that we are able to get the best ambulance setup. If we say that we want 100 ambulances, our Joint Secretary Finance will tell you, I've been consistently, early morning I get up, first message goes to him, telling him like, no, please help me with this, please help me with that. It's not because of that, it's because we care for the people of the state of Goa. And we in Goa are a very small community, and we are a community, like you mentioned, that you know everybody. In last 16 years, I think we know everybody. We grow up and they also progress in life. We also grow, but we know each one by name. We know each one, their commitment to the healthcare. I would like to not say much today, but today the healthcare in the state of Goa is on a very progressive path. There are several other initiatives which we are taking forward, and also state care is one of the programs which I have consistently been saying. State care, sometimes, तुझे नाव घेतलं नाही रूपा? No, me now director health services. Just today afternoon also we are going to another place, and we are just trying to see how we can enhance the state care program. It's also going to be something like where we have these ambulances, and Mr. Bhatt were discussing our health services and everybody, where we are reaching out with facilities to the doorstep of the people, whether it is physiotherapy, palliative care, geriatric care, stroke patients, so that we have ambulance just like 108, and we are able to go to the homes of those people and see. And we have got a former director of health service who we want to put ahead of this program, so that we are able to reach. Also, the media is here. You have to understand many other issues which are not troubling my mind. The other issues that are troubling my mind is what we can do for the state of Goa. And with the blessings of people like Mr. Shripad Naikji, who has been in the Union Cabinet for so long, I mean, it becomes so easy for us that we have somebody, is like a godfather to all of us, that we, even without saying anything, he gives it to us. What I wanted to say is that when we have these programs like State Cares, when we reach out to the people at home, when we have dialysis patients, we have a drop-back facility for the dialysis patients. Whether we have patients like, we have cancer and chemotherapy patients. So that is called the State Care. Still today, nobody has actually, deciphered the whole thing, what I'm trying to do on State Cares. And our state is very small. And if we are able to map the population, तुम्ही सगळे पत्रकार भाव बसल्या, श्रीमंताचो श्रीमंत मनीस जर असल्यार त्याच्या घरा जर ताका वेळ ना तो आईकडे पळू शकना. हायेन पणजे बी पळयल्ले आसा काही लोकांक ते मागीर कपडो बिपडो घेवन जाणटे लोक मागीर ते धडपडटात घरान की बाबा कोण आपल्याक पळोवपाक नासता. मिस्टर श्रीपाद नायक सांगतले तुमकां ते प्रचार खूब केला घरोघरी. म्हाका दिसता नॉर्थ गोवा तांकां अशें आमी एस्ट्रॉलॉजर कशे वयता तो मागीर आमी हातीर पळयतात न्ही लायन कशें आसा ताका आपले पूर्ण मतदारसंघ आनी गोंयभर तो सगळीकडे भोंवले व्यक्तिमत्व. आनी ह्याच तरेन आमकां लोकांची चिंता आहा. ह्याच तरेन आमकां कितें तरी वेगळें करपाक जाय. When we talk of healthcare, it is taking it to the last milestone as the vision of the Honorable Prime Minister Shri Modi ji, who says that you must take healthcare to the doorstep of the people. By just giving long speeches, it's not going to help us. It's important for us to encompass everybody and every strata of society to see that they come covered into this program of state cares. Very important. Many times people require chemotherapy, they cannot reach the spot where they need to take chemotherapy. There are many dialysis patients, people don't have the time to take their relatives to do the dialysis. So this state cares is something which will be one of the most innovative programs, and Goa will be the first state in the country to actually flag it off. And let me tell you, madam, is that when we have leaders like Mr. Shripad Naik, he's a very simple person. You'll not, if you go to other states, you'll wonder with 10, 12 cars, you'll see everybody coming with paraphernalia, actually seeing that, but our leader doesn't move like that. You don't even know where he's moving. Suddenly I cross him in the middle. I ask who's gone in this car. Then they say, okay, Mr. Shripad Naik has just passed. Because he goes to every strata, goes to every person and sees what is, and he's well experienced and a person who's very close to me, my family. And something which, you need to learn from him is simplicity and commitment to the people of the state of Goa. And having a leader like this at the helm will definitely help the people of the state of Goa. I publicly तुमच्या सगळ्यांक घातलें एक स्टेटमेंट आता केलो तुम्ही ते आता विचार करत बसा तुम्ही कितें केला ते. आणि बाकीचे प्रश्न विचारपाचे पयलीं तुम्ही बाकीचे हांव गुप्त नवरात्री आता बेगीन येवपाची आहा ते गुप्त स्टेटमेंट कितें काडटा तेजेर लक्ष दियात. मेन म्हणजे ह्या तरेचें नेतृत्व असल्यार तो मागीर गरीब लोकांक सांबाळूंक शकता. गरीब जनतेक योग्य तरेचे बेश्टे मंत्री जालो म्हणून जायना. त्यांनी स्वताचे जिवनान जे अनुभव घेतल्या, स्वताचे जिवनान जे घटना घडल्या ते आनी तेजे कमिटमेंट गोंयचे जनते खातीर फर्म केल्ले आसा. आनी म्हाका दिसता की त्या तरेचे नेतृत्वाचे मार्गदर्शन आमकां गावल्यार खुबशे बरे गोष्टी आमी करूं शकतले. I would like to thank you on this occasion that on the initiative of Mr. Shripad Naik ji, NTPC has taken a leap in trying to see that we are able to do good service to the people of the state of Goa, and definitely this initiative is going to help the 108 strengthen its life-saving initiative. Thank you so much, madam. Thank you.
Thank you, sir, for your inspiring and insightful address. Your vision for strengthening the state's healthcare system and your emphasis on collaborative efforts under CSR will undoubtedly motivate all to continue working towards accessible and quality healthcare for every citizen. Ladies and gentlemen, as we stand at the threshold of this remarkable event, it is with great honor and anticipation that I extend an invitation to our distinguished Honorable Minister of State for New and Renewable Energy, Government of India, Shri Shripad Naik ji, to deliver the address and share his insights with us. A strong advocate of collaborative development, Sir has played a key role in fostering partnerships with public sector undertakings to mobilize CSR support for strengthening public health care. His commitment to public welfare has helped translate meaningful partnerships into tangible benefits for the people of Goa. His visionary leadership and continued support have greatly contributed to the successful realization of such meaningful endeavors. With these words, it is my distinct honor to invite our esteemed Honorable Minister of State for New and Renewable Energy, Government of India, Shri Shripad Naik ji, sir, to address this august gathering.
Namaskar. Sri Vishwajit Raneji, Honorable Health Minister, Government of Goa. Ms. Vandana Chaturvedi, Regional Head, HR, Western Region 1, Mumbai, Office of the NTPC Limited. Dean of Goa Medical College, Dr. Tiwari ji, Dr. Girida ji, Director of Health, Dr. Rupa Naik ji, Dr. Kedar Aikar ji, Dr. Bhatt ji, friends from media, ladies and gentlemen. Today marks another significant milestone in our collective effort to strengthen the Goa's healthcare system. We are gathered here for the inauguration of handing over 19 healthcare vehicles to Director of Health Services under the Corporate Social Responsibility Initiative of NTPC Limited, Western Region, Mumbai. At the outset, I express my heartfelt gratitude to NTPC Limited for this generous contribution. The fleet comprised of 6 basic life support ambulances, 8 advanced life support ambulances, 2 cardiac ambulances and 3 medical transportation vans. These vehicles will significantly enhance the Goa's emergency healthcare network by ensuring faster emergency response, better patient care during the transit and efficient transportation of medicines to primary health centers and community health centers across the state. Friends, healthcare and education have always remained my highest priority. Every rupee allocated under the MP-led fund and every CSR partnership that we have facilitated has been guided by the objective of improving the quality of the life of our people. Today's event is a continuation of that commitment. Through CSR initiative, we have earlier facilitated 4 crore state-of-art mobile cancer detection van to Goa Medical College, enabling the early cancer screening across the state. Cancer detection bus has saved several lives due to the timely detection of cancer. We also played an important role in bringing central government support for super specialty hospital also, cancer block also. Our effort has also contributed to the establishment of the Ayush Hospital and Dhargar, 2 district hospitals, and the Ayush Research Center at Ribandar, strengthening the healthcare infrastructure across the Goa. I am pleased that NTPC has also sanctioned 6 crore under the CSR program, and by that fund we have allocated this 19 ambulances and other vehicles. During the 18th Lok Sabha, we have also focused on education, renewable energy, social welfare and community infrastructure. Under the CSR initiative of Food Co, 4 school buses have been provided to the educational institution at Talauli, Sakli, Kepe and Pinna, benefiting the hundreds of students every day. With the support of IRIDA, we inaugurated 45 kilowatt solar power plant for the drinking water department at Kadamba Peto, Old Goa, promoting the clean energy in public infrastructure. Through the Goa CSR Authority, several solar power projects have been installed at community halls, temples, schools and the public institutions across the Ponda, Ribandar, Old Goa and other parts of the state, reducing the energy costs and promoting the sustainable development. Under the MP-led and CSR initiative, we also donated 3 hearse vans to the village panchayat, providing a computer to the IT equipment and school for across the Goa. Installed CCTV system in educational institution. Distributed motorized 3-wheeler and electrical wheelchair to Divyang benefit, empowering them with the greater mobility and dignity. Handing over an ambulance to the Institute of Psychiatry and Human Behavior at Bamboli also, provide an artificial limb a beneficiary in many villages. Supported the construction of community halls, crematorium, infrastructure, school facilities, compound halls, pathways and other community assets under the MP-led fund. Promoted renewable energy through additional on-grid solar project in temples and community halls. This project reflected our commitment to inclusive development where healthcare, education, renewable energy, social welfare and rural infrastructure move forward together. I sincerely appreciate Ms. Vandana Chaturvedi, Executive Director, NTPC National Region 1 and her entire team for choosing healthcare as a priority under CSR. I also compliment Honorable Ministry of Health, whose guidance and his efforts. All the projects are going smoothly, and we are adding many benefits to the people of Goa. I also compliment the Director of Health Services under the leadership of Dr. Rupanaik, the Goa CSR Authority, the DHS CSR team, led by the Kedar Raikar, and all officers and stakeholders who have worked tirelessly to make this initiative successful. I remain committed to bringing more central assistance, encouraging greater CSR participation, and ensuring that every available resource is utilized transparently and effectively for the welfare of our Goan people. Together, we will continue building a healthier, stronger, and more prosperous Goa. With these words, I once again give my condolence, Dr. Vandana Goem, ex-Director of Health, and request God to give the strength give him the strength to have this what you call sorrow, to end this sorrow with his family. Thank you very much.
Thank you, sir. We are deeply honored to have had the privilege of listening to someone of your caliber. I extend our sincere gratitude for your time and your genuine commitment to making today's event a truly memorable one. As we near the end of our event, it is important that we take a moment to express our sincere gratitude to all who have contributed to making today's event a grand success. To help us